Early morning on September 15th, about 3 in the morning, I woke up with chest pains, which kind of felt like indigestion. I really didn't have a shortness of breath or anything else, but it was kind of a severe upper chest pain. And I was up for about an hour walking around and hoping that it would go away. Actually, I had had some spicy tacos the day before, so I thought maybe I had some indigestion. I went outside to get some fresh air that morning, and the pains wouldn't go away. But eventually I said, we need to go get this checked out. Susan and I really didn't give it a second thought as to where we were going to go. We knew that St. Mary's was not only close to us, but they had the cardiac facilities to see if there was anything wrong. We went to St. Mary that evening and checked into the emergency room with chest pains.
The minute I walked in and said, my husband's having a heart, and that's all I got out, they ran past me, grabbed him, brought him in. They were on top of him, doing tests constantly. They had people everywhere.
It was immediately clear this is not the usual heart attack. This is something very unusual. What the patient has is really an abnormal coronary. It's something he was born with, congenital abnormality of the coronary system. It happens in about 1% of the population.
Ultimately, when you're told that you need to have open heart surgery, you're kind of shocked a little bit that you're going to go into that within the next hour.
It was totally emotional. I just kind of sat back and I thought, oh, what is going on here?
In order to reroute the circulation to what it should be in a normal person's anatomy, we had to dig the abnormal vessel out, and these are all buried inside the muscle. And it's usually a little bit treacherous when you try to dig inside the heart muscle and try to expose these vessels. That's what we had to do. And more complicating than that is the fact that sometimes these congenital problems are also associated with aneurysms. And that's what he has. He had, in addition, an aneurysm. That wasn't the reason he was having a problem, but this aneurysm is big enough that he could dissect the aorta at some point.
Scott's sister came in and I called her. She came in and helped me. She helped with the staff. Then the way they found things, it was just amazing how they have all the machinery and the technology, and the people there had a lot of knowledge. You don't know the technical terms, you don't know it, but they kind of made it so I could understand.
When my sister-in-law called me about 4:30 in the morning, I didn't panic. I knew she was taking him to St. Mary's. In fact, they were already there. I did not feel the need to call anybody and say, hey, my brother's there, get this doctor, use this equipment, make sure you do this, put him in this room. I didn't have to do that. I knew inherently that he'd be well taken care of, whether they knew I was related to him or not. I
was in kind of a bad shape, and it was important that I had gotten the care that I needed pretty soon. We don't know how long I would have made it without the diagnosis. It made me reflect back on the contributions the community made towards that equipment in the hospital that helped me along, that helped with my diagnosis and ultimately helped with my care and recovery in St. Mary Hospital.